The reason for developing this program and developing GWESA is that we recognise that primary care and primary care health professionals need support to improve the quality of care we provide to people affected by cancer. The way we're trying to do this is by developing support, guidance, education and resources to help primary care health care professionals know what the needs of our patients are and give them the right tools to meet those needs. We're also working on building up a closer relationship between primary care and secondary care so that we can make things more joined up and make the care we provide more effective and efficient. We're also looking at the long term and how we can make sure that any improvements we make over the next few years are sustained in the long term by developing a community of practice of interested professionals in primary care and community setting who can support cancer care in the long term. There are lots of challenges for primary care when we look at caring for people affected by cancer. And I think you can split this into issues around prevention and diagnosis of cancer, but also the support we provide to people when they're going through their treatment, and then what happens afterwards and the support they need after they've had cancer treatment in the long term. One of the biggest challenges for primary care is that cancer is only one part of our role as GPs and practice nurses and other professionals in the community. Therefore, we don't necessarily always have the in-depth knowledge and skills to help our patients. Therefore, increasing the knowledge that we as healthcare professionals in primary care have is an important aspect of the work of our programme. Also, one of the other key challenges is how we work with secondary care, how we communicate with secondary care services and how we share information as best to support our patients. Then there's the issue of what happens after treatment, and this is something that quite often we as GPs and other primary care professionals perhaps forget, that after cancer treatment people still do have needs that possibly aren't met and aren't addressed. And a lot of my patients talk about after having treatment that they're in this bubble, this cocoon whilst they're undergoing cancer treatment, and then they're discharged and they come back into the community and they feel like they're abandoned, like they fall off a cliff edge. And I think there's a strong role for primary care to support people at that time. Then there comes the question of how do we achieve these improvements in cancer care? I think one of the main areas of focus is around diagnosis of cancer and getting earlier diagnosis of cancer. And what we're doing is again providing guidance and education and information for GPs and other professionals about how to spot symptoms of cancer and how to spot the patients who need investigating, bearing in mind that quite often it's difficult to pick those patients up because although we think of cancer having very specific barn door symptoms, that isn't always the case. Sometimes the symptoms and the presentation can be very vague. So we're looking at ways of how we can help GPs spot those patients with vague symptoms. But also what we're doing is once the GP has a suspicion of cancer, we're working on systems to help them investigate those patients promptly, such as setting up vague symptom clinics or rapid diagnosis centres. Other things that we're doing to help support patients and to help achieve the improvements that we want to are by looking at what support people need during treatment, how we improve communication between specialists and GPs, how we share information about patients so that if a patient needs to contact the GP about a problem with their cancer treatment, the GP knows about it and the GP knows what to do about it. And we've got some of our team working in specialist cancer centres with oncologists to develop ways of sharing information. Then we look at what happens to the person after they've had their cancer treatment in the long term. We recognise that probably for us in primary care, we're not always the best at recognising that people who have been cured of cancer, that they still have some issues and problems in the long term, either because of their cancer or because of the treatment they had. So some of our nursing team are looking at developing the use of a holistic needs assessment in primary care to help identify what our patients' issues and needs, and only by identifying those needs can we then look at how we solve them. Addressing all these issues for our patients affected by cancer, it might feel like a mountain to climb, but we know that although the numbers of people affected by cancer and people being diagnosed with cancer are increasing, that if we look at the proportion of these patients from a GP's practice list as a whole, they're not massive numbers. They are manageable and we can deal with them. But it's all about identifying those patients and having a system in place for proactively identifying their needs and addressing their needs.